Hi, my name is Magdalene Kuznia, and today I would like to propose a clinical decision support system to assess for homelessness. This is a new clinical decision support rule, or CDS rule, to assess homelessness and food security for patients entering the hospital. It will be modeled from the CDS rule from the VA. If a patient screens positive upon admission for either homelessness or food insecurity, the CDS rule will alert the registered nurse to contact social work and the hospitalist to contact psychiatry and or palliative care for a consult. Homelessness affects at least 1.5 million people each year in the United States. Those experiencing homelessness are expected to live 12 years less than the average American and also have a higher chance of contracting some sort of chronic illness, such as HIV, hepatitis C, depression, or any substance abuse disorders. This CDS will be utilized upon any admission to the hospital and saved with each healthcare encounter, along with the rest of the admission intake information. So, for example, if a patient comes in and they're incapacitated to follow the screening tool, then it is a next shift's nurse responsibility to complete the assessment in order to make sure that we assess properly. And it'll become the next nurse's responsibility and the next nurse's responsibility until we can get appropriate answers from the patient. The outcome for the questionnaire will give the nurse an option to call for social work and the physician to reach out to psychiatry and or palliative care. So it's important for the nurse to reach out to the social worker so that way the patient can possibly be involved in community support systems if necessary. If the physician needs a psychiatry or palliative care consult, this will give the patient an opportunity to keep up with their mental health, connect to mental health resources, possibly be on medication to maintain their mentation, and or palliative care if the patient decides that they don't want any of these extra things, if they don't want certain procedures, and if they want to stay comfortable. It's important to begin evaluating this as soon as possible to upkeep care outside of the hospital and to stay focused when we're inside of the hospital. The necessary team members to implement this rule are the nurse, physician, social worker, psychiatrist, and palliative care team. This is an example of what the CDS rule would look like. First, we'll ask in the past 2 months, have you been living in stable housing? And so by that, we mean affordable, permanent, safe, decent, and livable housing. If that's a yes, we continue to assess if they can maintain this housing for the next 60 days. If that's also a yes, then great, we're done with the screening. If it's a no, then we continue with the no side of the screening. Where have they lived for the past 2 months? Um, if either way, whatever they answer, it will alert the RN to write for the social work consult and alert the physician to write for a psychiatry and or palliative care consult. We also would like to assess for food security because it may relate to a housing situation. Um, we want to ask if they're confident they'll have enough food or money to buy food for at least the next 3 months. A yes ends the assessment, and the no will alert for a social work consult. It may seem like this will overwhelm certain services, but it may decrease the length of a hospital admission because we'll start working on what a patient needs at the beginning of an admission. And we won't be in this tricky situation of a patient pending placement. We'll understand what the patient wants and what they need, and we can start working on that right away, whether it be a skilled nursing facility, a medical respite, a group home, etc. We want to measure the success of the CDS over the course of 6 months. We'll first implement this on one nursing floor for 3 months, and then open it up to a second nursing floor for the second part of 3 months. So in total, 2 floors, 6 months. Ideally, we'll see a 10% decreased length of stay for patients experiencing homelessness. It will be up to the IT team to implement the CDS within the electronic health record system. It will be up to nurse managers and the director of nursing to analyze this data and make a decision to keep this CDS. Again, in conclusion, it may seem like it will overwhelm certain services, but we personally believe it will decrease the length of hospital admission because a patient won't be pending placement for discharge at the end. We'll know what they want and need from the beginning. Through this, we can appropriately utilize services. The data collection and analysis will occur by the nurse managers after 6 months. These are my references. Thank you.